Many doctors still believe that Black patients are less likely to feel pain based on false beliefs about skin thickness. There's the myth that Black patients have less nerve endings or that their blood coagulates more quickly. My name is Bervell. I'm a fourth-year medical student, but online I'm better known as a medical Mythbuster for creating short-form content about racial biases in medicine and the ways that healthcare needs to change to be more inclusive for all populations.
Let's talk about the racialization of X-ray radiation. Did you know that artificial intelligence can actually exacerbate healthcare disparities? There's a racial adjustment in a common prenatal screening blood test.
I started creating content in the midst of the COVID pandemic. At the time, I was thinking a lot about what it meant to be part of a field where less than 5% of physicians are Black, and also what it just meant to be able to have a voice. And then I learned about pulse oximeters.
This is a pulse oximeter. It measures your blood oxygen saturation level, but studies have shown that it doesn't treat all skin tones equally. A recent study found that pulse oximeter differences were associated with Black, Asian, and Hispanic patients receiving less supplemental oxygen than white patients.
I was so shocked that I had never learned this, and so that was my first video that I posted. And within 24 hours of posting my video, it got over 500,000 views. And there was nurses and doctors saying, I had no idea about this disparity with pulse oximeters, yet I use this device every single day. And on the flip side, there was patients saying, I wonder if this is why my loved one passed away. And reading those comments made me realize that we don't talk about this in medical school or anywhere else. So for me, one of the big things I'm trying to do is connect how the socio-political and economic factors of the world that impact race connect to these larger systemic issues of health. In medical school, for example, I often heard that Black patients are more likely to get asthma, but we never talked about the socio-political reasons why, where it's actually nothing to do with race, but had everything to do with the fact that redlining led to Black communities to be closer to factories. And so really what I'm trying to do is highlight the research that's out there that shows that the way we're thinking about it is wrong.
Authors estimate that without this disparity, Black patients receiving additional help would have increased from 17.7 to 46.
With every video that I'm creating, they're all 30 to 90 seconds, but my goal is to talk as if I'm speaking to my mom, my brother, someone who I love, and I know that I would want them to have this information so that when they go to the doctor, they feel as if they have a little bit more autonomy in understanding what's happening to them.